smash the like button, and subscribe. If you knew that you were going to take 30 million people off of Medicaid, would you be okay with that?
I think the number in of itself is irrelevant. I think the key word of the bill right now is able-bodied people putting in at least
Wait,
80
could you
hours of
answer my
work per
question?
month.
Can you answer my question?
And the numbers here, 30 million, 100 million, doesn't matter. It really does not matter. What I'm trying to say is that the work
So I have a
requirement, it's not
question.
even a true work requirement.
If you knew that cutting 100 million people off of their health insurance, right, or whatever number specifically it was going to lead to like say 1,000 people dying, would you then disagree with doing that?
And I've heard you make that argument before. I think you're playing too much into the emotional part of it, which is you support death of people. Of course I don't, Parker. Come on. That that's not what I'm advocating for at all.
So if your policy led to the deaths of 1,000 people, you disagree with your position?
Can you describe in what way they directly lose
Yeah,
or
they die.
die because of that change?
They die because it is the case that they couldn't get access to or afford to preventative health insurance, right, or preventative health care, which then led to them, developing harsher conditions in the long run, which then led to their treatments specifically being less effective, them not being able to afford going into that much debt to be able to treat themselves, right, and or the insurance just not accepting them because of that. So there are plenty of reasons why people can die because it is the case that they did not get access to preventative health insurance that is incredibly important in terms of, people ensuring their health in the long run.
When I think about where I think the problem of the left in this particular area, Parker, nobody supports people dying. The problem is every issue is a priority for the left.
I
Homelessness, right? We've been trying to fix homelessness for a million years. I live in California. I see homeless people everywhere, dying. Nobody's doing nothing about it.
By the way,
So, Parker, I can ask you this.
you can't refer to any DRUG. Just letting you know.
Oh, sorry about that. So what does DR? Could you elaborate? I'm not sure what you mean.
You just can't refer to any DRUG in specific.
Oh, gotcha. Sorry about that. I personally feel the epidemic we have on the, of unhoused people is significantly worse
Can you name one
than
policy that
people.
Donald Trump has to support people who are homeless?
No, I'm not telling you that's the area he's, known for. I'm telling you what
Did you know
I
his
think
policies would hurt people in the bottom 25%, which would then lead to more people becoming homeless?
because of the big beautiful bill, or in what area?
Because of the big beautiful bill.
I haven't seen anything in the big beautiful bill that truly hurts people on the bottom outside of the
Really?
Medicaid part,
This
which the way they're going about it, in my opinion, is very
I
surgical.
just want to let you know, if we
Parker,
reference the big
but look
beautiful
at
bill and the effect on after tax income, right, is a negative for people in the bottom 25%.
okay, so Parker, the biggest
You say it's
argument you came
surgical,
up
you
with
have no
earlier is
evidence of
that
it.
it's able-bodied people putting in 80 hours of work per month, and it doesn't even have to be work. You can volunteer or search for work.
By the way, people, you want them to do 20 hours of work in terms of volunteering without pay in order to be able to get health insurance? Dude, are
If
you
the
okay?
health insurance, it's not, you don't have to just volunteer. You can also look for work, Parker.
You understand
The
that for
bill
many people,
clearly,
yeah, you just saying look for work like they haven't thought of that already. Are you okay, dude? Do you think people aren't looking for work? Dude, people are working hard as fuck on Medicaid, and they're going to be cut from this because it is the case of the shitty policies. That's how it is.
okay, so
Every single person in this country, regardless, should have health insurance. No single person in this country should go without health insurance. The fact that you're okay with cutting millions and millions and millions of people off their health insurance just because you are greedy is absolutely despicable. It's disgusting.
I'm
And
not
actually,
greedy.
history is going to look back on this as like, what the was wrong with these people that voted for Donald Trump specifically, right? That literally got this country, right? Of, our money, right? Trillions of dollars in the debt, right? Cut Medicaid, cut food stamps, cut the Affordable Care Act, cut Medicare, right? Cut the CDC, cut scientific programs within the federal government, cut the federal government size in general in terms of the employees without actually determining whether or not they're actually relevant, particularly in terms of that particular field, right? Just whether or not they're like, going to be in support of Donald Trump, right? Cut education, like that's horrible. Do you not realize the importance of how horrible this is for our country? This sets us back. This does not push us forward. It sets us back. And we're going to take decades to build back what has been literally destroyed by Donald Trump in terms of our democracy, our court system, right? Our trust in our public systems and science, right? You understand that, right?
I understand what you're saying. What I think you're saying is you haven't explained to someone like me who pays on average, at least the last 5 years, I pay 10 grand out of pocket every year for my health insurance, co-insurance
Yeah,
costs,
and that's more
medical
than.
costs.
And
I
you want to know
pay.
something crazy? That's more than
So
practically every other country around the world that's developed that has
I
universal health insurance. So if you
I
want to
agree.
actually
So
pay
now,
less, well then why don't you support a universal health insurance? Because you can pay less.
no, 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 Parker. You see that that's not the answer. To me, the answer is not go straight to a government run program to answer all of our problems. The
It's
government
worked.
is very rarely efficient at this kind of
Wrong,
stuff.
wrong,
Very,
wrong, wrong. Name one country around the world that has a good healthcare system that has no public involvement.
no, what you're advocating for is a 100% run government program. That's what you're advocating for. Basically Canada's model, right?
No, what I'm advocating for is there can still be private health insurance, but there is a public option provided for everyone that everyone that gets that's really good quality that provides for everyone. That's the baseline. You want to provide a baseline for everyone. You can have a market, but a baseline for everyone. Every single
I,
person
I
gets
agree. I
adequate,
agree with the
adequate, right? Healthcare. Every single
I
person.
agree with a baseline type insurance, but you do know Medicare is often referred to as a gold plan, right? It's better than what I get, and I pay 10,000 a year, Parker. Explain that to people who pay for their insurance that are getting
Hey,
the
dude.
value
Hey,
of
dude.
what a
Hey,
lot of
dude.
these people get for
Yeah,
free.
well, you're just getting ripped off by private health insurance. So how about you realize? How about you realize you're getting ripped off instead of blaming the
And
government for
what's
providing a
what's
better
what's my
service?
what's my alternative? I work. I'm ineligible for all these
Wait,
programs.
by
So
the way,
what's the alternative,
he
Parker?
just said that Medicare is better than what he has right now, spending $10,000 a year. Yet it is the case that Medicare for all would literally expand on what Medicare already has. It would be even more expansive than what Medicare is right now, and it would be the case that it would cost less. It would save around $450 billion from a governmental perspective on a yearly basis, or not government, no, an overall society perspective, not government.
You haven't explained to me how it's fair. I often hear people on the left use the word fair. How is it fair that you have hundreds of millions of people who work in this country for their own insurance, who have to grind it out week after week after week for people to just sign up and get it for free? You haven't explained that to me. Who are able bodied, able to go work. Explain that to me, please. I'm willing to listen to any argument you have.
Yeah, 45 to 68,000 American lives are lost every single year due to lack of health insurance because people can't get access to preventative health care. And it is the case that in this country, if people can't afford health insurance, that they will die at a greater likelihood. If you want more Americans to die because they can't afford health insurance, yeah, then you don't care about America. You don't love America. You're not a patriot. You don't
That's
love
not
this
it.
country and you don't fight for this country. If you cared about this country, you would obviously support policies that are not only more cost effective and would cost you less, but would also save 45 to 68,000 American lives every single year. Do you realize how many people that is? How many people lost their family members, lost their grandparents, lost their moms, right? Their dads, right? Their significant others, right? You understand people that they really care about, their friends. You understand that people's lives were lost because they couldn't afford health insurance. You understand that, right?
All right, now
45 to
I'm gonna give you
68,000 American lives that lost every single year.
I'm gonna give you another scenario that's equally sad. I'm sure a lot of people on your call, like myself, struggle with anxiety. They've struggled with depression. They've struggled with a million other health disorders. People in my family have histories of strokes, heart attacks, all of these things. Parker, I kill myself every week working.
Okay, I don't know if you
Do you
can say that
think
on the
my
line, man.
life expected? I'm sorry. Do you think my life expectancy is going to be longer or shorter if I continue working at the rate that I am?
Lower.
Aren't I not gonna live a shorter life because
Extremely.
of the amount of work I do?
Probably lower. Push the dinosaur if you're
Probably
stressing
lower.
yourself out.
Yeah, so the reality is
So
we
so
all
so then how
have
about this? How about this? How about this? We want a society that makes it so you don't have to work as much in order to be able to provide for your family, right? So maybe if you had universal access to healthcare, childcare, housing affordability, maybe if you had like the government actually standing up for helping you out and providing security for you and your family, maybe you wouldn't have to, stress out
there
so much.
there's Parker, there's nothing in life that I've ever been given that was more satisfying than something I worked for and earned myself.
Yeah,
Nothing.
yeah, but
Nothing in
I
life.
just want to let you know, not everything that's satisfying in life do you just do yourself. There are plenty of things that are satisfying in life that you don't just do yourself. In society, we live in a society that we rely on other people. I don't do everything relating to my own life by myself. Do you think I get the water I drink or shower myself with or the energy that I'm using right now to go live on? No, obviously I don't do that. We live in a society and we rely on other people. That's how it works. We rely on other people, we work with other people, and now we have better things for ourselves. So obviously, I think that there should be certain things that, are provided by society because they're bare necessities and people rely on them to live. And the whole point of an economic model in the very first place is to ensure the very bare necessities of everyone, to make sure everyone's taken care of. And then we can talk about everything moving forward. All of the great things that we can get from market-based societies beyond that. We can talk about that. But let's ensure everyone has base necessities. That's a bare minimum. That's the whole basis of an economic model, is to ensure everyone has food, everyone's taken care of, everyone's got a house, everyone's got healthcare. That's the whole point. And if we can't ensure that, what the fuck are we doing here? Genuinely, what the fuck are we doing here with this economic model? We have to be thinking about that. We have to care about people. We have to be compassionate. We have to have empathy for people in our communities. Because if we don't have empathy for people in our communities, we do worse off, not only ourselves, but we do worse off as a society. And it's better that we want a better society for everyone, because your children are going to grow up in that society. Their children are going to grow up in that society. And the children that come after them are going to grow up in that society. And if you care about anyone in your damn family, you'd care about the future that you're living for them. Or future that you're leaving for them.
Of course I do. Of course I do, but I also believe in proper incentives being in place. And right now, unfortunately, we incentivize too many people to not do more than what makes them slightly uncomfortable.
How about this? We
That's the reality.
What about the bad and malicious incentives, specifically about people profiting off of people dying? How about we talk about that? What about the malicious aspects of that? Why don't you talk about the intentions when it comes to that?
Are you talking about like the health insurance
the
industry,
incentives?
the medical industry?
What incentives are you creating in a society to create a society where people are profiting off of others dying? Don't you want to make that illegal? Don't you not want to do that as much as you possibly can in a society?
I guess when you talk about incentives, you have to talk about an incentive for an individual person or a corporation. Who are you talking about right now?
Wait, I'm talking about the incentives for society, which would include people and corporations. Corporations are made up of people.
Yeah, I understand that, but right now, which incentives specifically are you referring to? When I'm talking about incentivizing people, I'm talking about
I'll give you an
majority
example.
individuals.
I'll give you an example.
You have to
like, if we don't have
Sure.
regulations, companies will have incentives to pollute waters that people rely on to survive. And then people would use those waters, and it is the case that they would then die because of the pollution. But it was profitable for that company. Do you realize what's profitable for that company is not what's most profitable for society as a whole? And actually, the entirety of the social welfare as a whole would be worse off if it is the case that that company is allowed to pollute. Even though it's more profitable for them, even though it makes more sense from a monetary perspective for them individually, it's not better for society as a whole, because more people now have their health negatively impacted and have to have costs related to the negative impact in terms of what it would have been comparative to what it would have been without the pollution. Do you understand that that is how we use governmental regulation? And that when people say that governmental
I am for regulation. Okay. That's fine.
Okay. Response.
That's fine. We're not talking about government regulation here, though. What you're talking about is giving stuff away from free. Who are you regulating? Who are we talking about regulating here in what you're describing, Parker?
We're regulating the market by providing we're regulating the market by providing a social service for people to ensure a baseline of how people are treated. Think about how a minimum wage is also applied. You're applying a bare standard minimum level of care. That's what we're also doing in the market here when we provide a social service. Does that make sense? It's not scary, bad government intervention. It's children having food on their tables. It's people having health insurance. He just left, by the way. It's people having health insurance, It's people having affordable housing, okay? It's us having taxpayer dollars going to fund scientists, right, that are studying things to save lives, okay? I mean, that's what we're putting our money into that Donald Trump is cutting. You know what I mean? Like, that's what he's deciding to cut. Instead of, funding those things for the common good of the American people, what he thinks is better to do is to give ICE, right, $130 billion over the next, I think, 5 years, right? A budget that is larger than the state of Israel's entire military budget. Just want to clarify. Higher than Italy's, okay? We're spending more on ICE than Italy spends on the military as a country, okay? We're militarizing our southern border rather than providing compassion and empathy to people that are coming to our society for a better place for themselves and to make this country a better place. Because when we allow for immigration, that's what happens. This country becomes a better place. It really does. When people come to the country who haven't committed violent crimes or bad crimes,